The following is a presentation of Project Independence and WCWP. Project Independence is the Aging in Place initiative of the town of North Hempstead. We provide programs and services designed to assist and support the older town residents who wish to remain in their homes as they age. If we don't currently provide a service, we will try and connect you to that service. Call 311 or 869-6311 to get more information or receive services.
Welcome to Project Independence and You.
Welcome to Senior Talk Radio here on 88.1 FM and WCWP.org. This is Project Independence and You. I'm your host, John Ryan, and my co-host today is Otto Los.
Good morning, John. Glad to see you.
Good morning, Otto. It's glad to see you. I haven't been here for a couple of weeks, and it's always great when we're together. And today we have a very, very interesting conversation, and we're going to be with Barry Klitsberg. And Barry is the Assistant Program Coordinator for Nassau County HIICAP program. And Barry's going to tell me, of course, what HIICAP stands for. But we're going to be talking about Medicare and how people get it and how people have gotten thrown off. I mean, the one thing that Christina Liu has been doing as the producer of this radio program is bringing in time-sensitive speakers to talk about stuff that's going on during the pandemic and how it's affecting people. And just a brief conversation we had with Barry prior to starting the program, many people, probably hundreds of thousands, have been affected by losing their jobs a little sooner than they expected. Barry, good morning, and thank you so much for joining us.
Good morning, John. Good to be with you again.
Same here. And I'm going to start off with a generic question that we were talking about, Otto and myself and you, in reference to, one, how people sign up for Medicare, and then two, how that has been thrown off with the pandemic.
Thank you. I mean, we're getting a lot of questions. Just to answer your initial question, HIICAP stands for Health Insurance Information, Counseling, and Assistance Program. It is a free service for people who have Medicare questions. Either they're on Medicare and they need assistance navigating the system, or how to get into the system.
Okay.
Now, a lot of people who had health insurance from their job and continued to work after they were eligible for Medicare, they lost their job because of the pandemic and subsequently lost their health insurance. So what we are doing is helping people sign up for Medicare. There are certain forms that are needed to be filled out. So you could sign up when you lose your coverage without a penalty for enrolling after 65. And there are certain forms that we send to people, or we could email them, and they then fill that out. The employer verifies that they were working up until whenever and had coverage, and that goes to Social Security, and Social Security even set up a fax line because their offices are closed. So people can fax that information to Social Security, and they will then get their Medicare coverage the first day of the following month. So there's hopefully no gap in coverage, and at worst, it's a 1 month gap.
Okay. Now, am I right? So if you're 60, make it 65 years old, 60, you're still fully employed. Right. That person can apply for their Medicare card, but just have it. They don't have to use it. They just have it.
They can apply for Part A, which is premium.
Part A, right.
Free.
Thank you.
There's no premium for that, so there's no reason not to take it. When you stop working or you lose your employer coverage, then you could sign up for Part B, again, using the same forms that I mentioned for those other folks, without a penalty. Now, there are a lot of complications, but as long as there are 20 employees or more, then your employer coverage is primary and you don't need Medicare. If it's a small employer, you might want to consider taking Medicare, because usually Medicare would be primary.
Otto?
Is 65 still the magic number? You know, if you're 64 and a half, or you kind of out of luck, you have to go back on the market. And
65 is still the magic number unless you're getting Social Security disability for 2 years. All right, so about 80% of people are on Medicare because of age 65.
Okay, so if you're 63 and you lost your job, you got a big problem.
You can do one of two things. Either go with COBRA, which is expensive, or go to the marketplace and sign up for a plan until you're 65, then you would drop your marketplace coverage or your COBRA, if you're still on COBRA, and take Medicare, because Medicare is much less expensive than COBRA and usually provides more comprehensive care than the marketplace.
You know, Otto, that's a tremendous point you just made. I mean, the poor people, 62, 63, 64, just under 65, who have lost their jobs through this, they have no coverage, and it's terrible. I mean, that's the one thing. I mean, Medicare is a gift. There's no question about it. And COBRA is, because I know people have been on COBRA, it's a fortune. And going out to get any sort of private coverage for a couple of years, most people can't afford it. You could be talking $2,000 a month. I mean, and then on top of that, you have huge deductibles, you know, and that's just for an individual. I mean, I know individuals have to have done it for 2 years because, God forbid, something catastrophic happens to you, in the interim. You need the insurance. You have too much at risk.
But you can't afford not to have it either, because if something happens, you know, nobody knows what's in store for any of us. And if you have no coverage, that's a serious problem. It's a bad, I mean, you could be, we're using a nice number like 63. You could be 59 or 60 and have a lot of years ahead of you to do that.
Right.
Maybe not be able to get a job. You know, there's a lot of people in a bad way because of this whole thing. It's a tough situation.
Yeah, what just happened now? I mean, there are people that are 50 and lost their jobs, 55. That I have no idea, you know. I know somebody that was planning on getting married and then did get married because they lost their job. And they said, you know, let's move this up because the spouse, the other person had the job. And so now they're covered, you know, under a spousal, as opposed to waiting a year or two to get the wedding going. They were almost, I mean, they wanted to get married eventually, but it kind of moved them up. And insurance moved them up. It wasn't love, it was insurance.
Yeah, I could just visualize this whole new dating game. You know, first of all, like with all the people, do you still drive? Yeah, I do. Do you have insurance?
Do you have insurance?
Okay, great. Let's get married. It's not funny, really, but, you know, trying to put a spin on it.
It's true. Actually, go ahead, Barry.
A lot of people who lost their jobs and have no income or even moderate income might also be eligible for the expanded Medicaid through the exchange. So it's not traditional Medicaid for people who are 65 or have a disability with low income and no resources. The expanded Medicaid has more lenient rules in terms of the requirements for, you know, income and asset eligibility. So a lot of people go on the marketplace, get Medicaid, and when you enter your information, it'll tell you can get Medicaid, and then when you're 65, you drop that for Medicare. So there are some, like I said, this is not like a menu where you pick one from column A and one from column B. You really need to look at this, talk to somebody or a marketplace navigator to find out what might work best for you. Now, we could start a person off, call us, we could let you know what's out there, refer you to the navigators in Nassau and Suffolk, and they can then give you more specific information. Or you go to the NewYorkStateOfHealth.com, and that's the marketplace website.
Going to the top line here, you have Medicare, which is not enough. So now you have to get a supplement / Medigap, I guess it could be called both, right? Or Medicare Advantage. So you have to, now you need to make a decision on what are you going to have as a support system, if you will, to your Medicare insurance. And that's what the date is that's coming up now, right? October?
October 15th through December 7th is the open enrollment season, where people can switch their drug plan or their Medicare Advantage to a different one. They have an additional season for Medicare Advantage, but the drug plans are October 15th through December 7th. If you're on a Medigap plan, those are the supplement plans, the A, B, C through N, you could switch any month. There's continuous open enrollment. So that you could switch any time. But these are
Oh, I didn't know that.
individualized questions. Medigaps are standard. So if you know what benefits you need, you can just look at the various companies that sell the different plans, how much they cost. And since they're standardized, it's easier. With Medicare Advantage or prescription drug plans, they're not standardized. So you've got to go in with our help or with the help of someone who is familiar with the system to go in to look at the individual Medicare Advantage plan or the drug plan and see which one works best for you by entering your drugs, by finding out, is your doctor in the network? Will they take that insurance if it's a Medicare Advantage? So those are more labor intensive. You've got to do more research. Now, we can help with that.
The Advantage plan seems to me to be, there's a lot, like I've been reading, there's a lot of new things which we can get into later, I think, about long-term coverage, long-term care and whatever. But it seems to me a little more of a gamble because maybe your doctor's in the plan right now, but something happens and you need to go to a different doctor who's a specialist who's not in the plan. Now, all of a sudden, you're on shaky ground, as I see it.
Yeah, well, that's definitely part of the equation. When people call me and they'll say, well, what's the best plan? And my answer is, what's the best ice cream flavor? It's what works for you. If you need to see a lot of specialists, then maybe an Advantage plan isn't good for you. Maybe you need a Medigap supplement plan with a separate drug plan, so you don't have to worry about a network. With a Medigap, any doctor that takes Medicare, the Medigap plan will work with that. So again, this is individualized. If you travel a lot, if you're a snowbird, Medicare Advantage, again, may not be the right way to go because you have a network. So if you go out of the network, you're either going to have a higher copay if it's a preferred provider organization, or you're going to pay the whole thing on your own if it's an HMO. So these are individual questions that I go through with everybody that calls asking for our advice.
You know, Barry, wait 1 second.
Yes.
Just, Barry, give out your phone number because I want to give it out a couple of times through the show.
Sure.
And you keep
Great.
saying people who call, but I don't have your number.
The number for the HIICAP in Nassau County.
Right.
Our hotline is 516-485-3754.
3754. Okay.
Right. We can repeat that as often as you want because, now that we're getting close to the open enrollment season, we want people to know that they can call us. We can walk them through. We have a couple of staff there plus some volunteers. So we're there Monday through Friday. And if it's busy or we step away from our desk for a minute, leave a message on the voicemail with your name and phone number. We will call you back usually that day, definitely within 2 days. And our message says that.
Everybody listening or watching this has to understand we are not the professionals. We are not the experts. People like Barry are. So get advice. Before you sign up for something, you have to get the advice because after a year or two of paying for something, to find out you didn't have all the coverage you thought you had, it's a shame.
I just found that out.
Yeah, okay, perfect, okay.
Well, I have Plan F, which has been on for a while. And what Barry just said was that Plan G might be a better alternative.
Which means you're going to be calling Barry during the week.
Well, the other part of that I didn't understand is that Medigap / supplemental can be signed up for or changed at any time. It doesn't have to be during the enrollment period. I've been kind of waiting here for the golden 6 weeks or whatever it is. When the phone is for everybody, it's like you're on hold forever because the whole planet is on the phone at that time. That's an important piece of information.
Medigaps you can change a Medigap plan any month during the year. There is no enrollment season. It's all right. You can, and if you have a plan you want, like F, which is not sold to new Medicare beneficiaries, but if you have it, you can keep it as long as you want. Obviously, you have to pay your premiums. That's the only reason they can drop you. but they can't drop you because it's not sold to new people. It's called guaranteed issue. You can keep your plan as long as you want. During the break, we were talking about the difference between some of the plans. Plan F covers everything as far as Medicare cost sharing. So your 20%, your deductibles, covers it all. Plan G does not cover your Medicare Part B, your medical insurance deductible. This year it's $198. Plan F covers it, Plan G does not. But if you look at the difference in the cost, all right, and I'm going to give you, based on our benchmark plan, one of the less expensive plans, it's $400 a year more for Plan F than G. So you're paying $400 a year to cover a benefit that's $198.
Per person.
That's right. So again,
Oh, thank you, Otto.
That's $800 for me a year.
Right, of course.
There are no family plans on Medicare. So again, yes, it is the most extensive coverage, but is it the best value?
That's good information for me personally, to be honest about it.
No,
Hopefully
because
somebody else who's listening.
you're paying another $200. It's out the window. Again, a lot of people like it. They took it before because it was the Cadillac plan. It was the best plan. It was, but not the best value necessarily. There are other plans that could work for you. Plan N, where you have a $20 copay when you go to the doctor, or $50 for an emergency visit. The difference there is about $740 a year in premium. So unless you go to the doctor 47 times for that $940 times 20, unless you go to the doctor a lot, Plan N might also be a better value. And the nice thing is, because let's say you take Plan N because you want to save some money on the premiums and you're in relatively good health. If at some point your health status changes, you can always switch to G.
Huh. So I've just saved a lot of money by listening to you, to be honest about it.
Yeah, you could make the check out to Barry. And we'll, no,
Barry, that's the conversation at the commercial, please,
Right.
not on the air.
This is the kind of thing, yes, of course. This is the kind of thing that people really need to get into the weeds about. So you can, get the detail. We could send you this information. It's all on one sheet of paper, the different plans and the benefits and who sells them, for how much. So we have this information. Again, if you call our office, we'll be glad to send it to you. Again, 516-485-3754. We can help you select a Medigap plan that works for you, or during the enrollment season, an Advantage plan. Now, one other thing about the Medicare Advantage plan, we talked about some of the disadvantages with the networks. One of the advantages of the Medicare Advantage plan is the premiums tend to be a lot lower, and many of them offer additional benefits like vision, dental, hearing, in some cases, transportation to and from medical appointments, fitness, an annual wellness exam, more thorough than the Medicare annual exam. So there are some benefits to being in the Medicare Advantage plan, and the drug coverage also. Almost all of them cover drugs, where Medigap does not. So you would need a separate drug plan for that. So again, based on the individual, we would help them find a plan that works for them. So again, it is, a little detail oriented. We need some information. When people call me, I ask them all these questions and they say, why do you need to know this? I said, because I want to help you find a plan that works for you.
I think what's most important here, and I'm going to reference Otto, which I do almost every week, multiple times a week, is that it's not just checking A or B or C. I mean, this is you have to do your homework because this is real money. And there's all these different options for a reason. And some will work better for me than they would, say, for Otto. But here's an example that Otto's bringing to our attention where he will probably be making an adjustment.
No doubt about it.
Right, that will benefit him. And the thousands of other listeners we have will be making adjustments. You're going to be very busy next week, Barry.
Well, 2 points here, all right? One, the devil is in the details, which is always the case in most things you do in life. And the other one is that what Barry's talking about is they don't sell insurance. They don't get paid for this. This is a free service. And you know, it's to me a great thing because this is a super complicated arena that we're involved with, which is health insurance. You know, like the Medicare Advantage thing. I've looked at it, and it's so hard to compare. You know what do you need? A lot of it is you don't know. You don't know what you're going to need next October or next September. You just don't know. Drug plans to me are even worse than that because they have these formularies now where something you were taking all along now all of a sudden falls into another tier and it becomes a super expensive proposition. Your thoughts on drug plans?
Well, again, this is one of those situations where it's based on the individual. Again, people say, what's the best plan? I'll say, what drugs do you take? If you're taking inexpensive generic drugs, you could probably get away with a very inexpensive drug plan. They start at $13.20 and go up to about $91 a month. For someone who's taking Lipitor, the generic Lipitor, or metformin, which is a drug, you know, glucophage is the brand name. But if you're taking metformin, you can probably get away with a very inexpensive plan because all the plans cover these drugs. They're inexpensive, generic. They will normally waive your deductible if it's an inexpensive drug like that, and you only pay a couple of dollars for your prescription. So you can do well with that, but again, we would need to know what drugs you take, what pharmacy you go to see if it's in their network as a preferred pharmacy or just in the network, and tailor it for you. And then you could just sign up.
You mentioned the Navigator earlier. When you say Navigator, these are websites that people can go to compare?
Navigators are federally funded agencies to help people with the Affordable Care Act exchange. So they will help guide you to a plan that works for you or to the expanded Medicaid from the exchange. It's similar to HIICAP in terms of free counseling and assistance, but it's specifically for the exchange. Okay. And you can even Google, Affordable Care Act navigators, and it'll give you, or on the NewYorkStateOfHealth.com, and you can click on if you need assistance, and it will give you every county in the state and a list of the navigator organizations within that county. And on Long Island, there are quite a few.
I just want to jump in here one more time and reiterate something again that Otto said. This service from HIICAP that Barry is offering is free. He's not getting paid to get you to switch from A to B to C to D or whatever. This is a program put together that does not get paid. Nobody gets charged anything. They are literally working to help each individual get the best program that's suited, for their needs. Excuse me.
We have no affiliation with anybody. We're funded by the federal government.
Okay.
By the Administration for Community Living. It used to be Medicare. It's Medicare money, but it goes through another agency. But we are totally funded by the federal government. The state gets funded for it, and they pass the money down to the individual counties based on the formula they used, our Medicare population within the county. So we have no affiliation with any agencies, insurance companies, brokers. We don't charge for it. We don't get a nickel from anybody other than the federal government to empower people to make the best decision.
We're having a wonderful, wonderful conversation with Barry Klitsberg, and Barry is the Assistant Program Coordinator for Nassau County HIICAP, a HIICAP program, which is a not-for-profit, no-charge organization helping people field Medicare questions. I think that's the best way of putting it. When people get to the age that you have to sign up for Medicare, and I hear it from people all the time, and I'm not there yet because I'm still working, but I have a Medicare card. It's craziness. You know, do you pick one? Do you pick the other? And every year it's changing. And honestly, I hear it a lot with Otto, who's constantly looking and keeping people informed on our conversations. So Barry, again, I mean, we're going into a third segment here, but I just want to thank you so much for participating with this, because this is very, very important to be sharing this with our listening audience and our viewing audience, because we are also on North Hempstead TV. So you're going to be a celebrity, both radio and TV.
I've actually sent a number of people to HIICAP, and they were all very pleased with what happened. So
oh, good.
That's a positive.
Actually, what I'm going to do before we go back to Barry, I'm giving out the number again. It's 516-485-3754. Call that number. Somebody will talk to you that day. Somebody's going to get back to you within a day or two. I mean, obviously, nowadays, everybody's very busy. People are working from home. We're doing the best we can. Call the number, leave a detailed message, and somebody will get back to you.
Yeah,
Barry,
I'm working from home 1 day a week, and the other 2 days I'm in the office.
Oh, you are? Okay.
The first thing I do when I sign on is I check the voicemail.
Okay.
To see if anybody called the night before or the day before and we didn't get to them. And I call them back in the morning. And a lot of times we can help them, even if I'm working from home. I have all my paperwork.
Right.
So it's working. We made it work. Not one call has been ignored or not answered during this entire pandemic.
And the important thing that I'm going to say about Barry is Barry has been, this is not like something Barry decided to do six months ago or a year ago in retirement. Barry has been in this arena, so to speak, for years. So he's extremely knowledgeable in the workings of Medicare and the government, etc. And that's the person you want, who can sit down and actually tell you, guess what, this can work for you, but this other program would save you $150 a year, a month, or whatever the numbers are going to be, and you're going to get just as much. And that's all you're looking for.
Right. And we will not endorse a company or a product. We'll guide you through it.
Okay.
And we'll help you make your choice. But we will not say you should take this company, they're the best company. We'll tell you what they charge for what services.
Right.
If it works for you, then we've done our job. But like I said, I won't endorse a company. I won't endorse a product or a mode of care. If you want Medicare Advantage because it's less expensive for the premium, but your doctors aren't in the network, I may say, think again. If your doctors are important to you, think again. We just had a situation, or we're in the middle of it now, where a large provider network was dropped by the insurance company. And people are scurrying to find a different insurance company because they want to keep their doctors. In some cases, they can switch mid-year. In some cases, they've got to wait for that period of October 15th through December 7th. So again, these are the advantages and disadvantages.
Now, you just mentioned they dropped they're dropped effective immediately?
October 1st.
October 1st, okay.
So it's not consistent with the Medicare year, which starts January 1st. The enrollment starts October through December, October 15th through December 7th. The change is effective January 1st. But when they changed their network, it was October 1st. So people might have to switch plans now if they can, or stay with the plan for their drug coverage or other doctors they may use. Right? But their primary care or specialty physicians, they may not have coverage. So we have to try to tell them what might be the best way to go.
You know, think about somebody who already is knee deep in a physical medical problem, and they've got doctors who were in the plan, and now all of a sudden they're not in the plan. That's a serious problem. You know, you have a doctor who you've been counting on and trusting and whatever for a long period of time, and all of a sudden that changes. That's a serious situation.
It's not serious. It's a disgrace.
Yeah.
I mean, do it in January, and even then it stinks. But I mean,
that's what I would.
In the middle.
That's what I would have preferred. But I don't make those decisions. Those are decisions made by individual businesses. They're allowed to change their network. Just so happens this was a big change.
Wow.
Mm-hmm. Yeah. So what I tell people is try to make your appointments in September, before October 1st.
Right.
And if you still have your coverage. So if you need to get prescriptions filled, right, or see other doctors, you can do that. You just can't use those network doctors. So try to get your appointments moved up if you can.
Right, and get everything finished before October
Right.
1st, and get
Now
3 months prescriptions and everything else.
Right. Well,
So
you could
you'll
get
be
your
good till
prescriptions
January, so
anytime.
to speak.
You could get your prescriptions anytime. Ask your doctor to write for refills. Or if you call the doctor's office, even if you're not seeing him right now, if he's your doctor, say, can you call my pharmacy for a refill? They'll do it usually because you're the patient and they have your records, and the plan will still cover your drugs. It's just not covering those doctors.
That's a problem if you think about it. I mean, okay, fine, by October 1st. But a lot of people have ongoing medical issues that require going back every month or every 2 months or whatever. And all of a sudden, your doctor who you've been going to isn't in the plan, isn't going to get paid. So now what? What you have to pay, or you have to get a coverage that will cover.
You have to pay unless you can switch. There are 2 instances where a person can switch outside of the open enrollment season. These are the most common reasons. One is if they are signed up for the New York State EPIC program, which is the prescription assistance program. If you have EPIC, you can make a one-time yearly switch anytime during the year to switch your plan. So that's your drug plan. Since in this case, the drug plan is associated with the health plan, you can make that switch. Or if you have extra help for your prescriptions, you can make one switch per quarter until the open enrollment season. So if you have extra help, you can switch in September, effective October 1st. Extra Help is a program for low-income folks where their Medicare Part B premium is paid. They get assistance for their prescriptions on top of their prescription coverage. They can switch also this month.
What is that one called?
It's called Extra Help.
Extra,
Technically, it's the low-income subsidy from Social Security. We call it Extra Help. If people are not sure if they're eligible, they can call us. We can go over their numbers and even send them the application for that program. And it goes to social services. We'll hand deliver it to them. So again, if people want these programs, they should call us. We'll be more than happy to talk through this with them, get them the information they need. We have all the paperwork for either program, for the Medicare Savings Program and Extra Help, or the EPIC program.
Okay.
Barry, just to be clear, you're Medicare focused. You would not get involved with Medicaid.
In terms of the application and approval process, we don't get involved. That's social services. People can apply through the Nassau County Department of Social Services or call the Nassau-Suffolk Hospital Council for assistance in applying for Medicare. They can help you through that. And again, if people call us, we will make the appropriate referral to them, but we don't get involved with the Medicaid application. You know, we know the rules. I'm kind of up to date on the rules of Medicaid, how that works, because even though it's partially funded by the federal government, it's funded by the state and county also. So the county runs it.
Wow, okay. What I'd like to do, Otto, if it's okay with you, and we only have a few more minutes in this segment, then we have one more segment. In this time of pandemic and everything's going on, I'd like to touch on if you have come across any fraud cases. I mean, it's an important thing right now for people to be paying attention to and getting on Medicare properly. And calling Barry at 516-485-3754 if you're at the point where you make the proper selections. But at the same time, are there things that people who have just signed up, are going to be signing up, or have been on, say Otto, who's been on for X number of years, have to be watching out for from a fraud perspective that they can actually be taken advantage of with all that's going on with hospitals and the confusion right now, which is it's terrible. I don't know. I don't have a word for it. Let's go with terrible.
There are cases. Now, I'm going to tell everybody one basic thing to remember. If somebody calls you and asks you for your information, your Medicare number, a bank number, because they'll say, well, we'll deduct your premiums from your bank. If somebody calls asking you for that information, hang up. First of all, Medicare will never call you and ask you for your Medicare number.
Okay.
They already have your Medicare number. They're not going to sell you anything, all right? If Medicare or Social Security contacts a person, it's going to be in writing through mail, regular mail. They won't email you anything, and they won't call you for any information. It'll be done through regular mail, telling you you might be eligible or you may want to apply for this. So you would only get it through mail. If somebody calls you asking you for information, that's a dead giveaway. Hang up. Because we are seeing cases of that. Even with the stimulus payment, that $1,200 per person payment that people were supposed to get earlier on this year, there were all kinds of scams. People calling up saying they're the IRS or Social Security. They want your bank account number so they can deposit it directly. No. Social Security already has your bank account number because they're mailing the checks directly to your bank. So they're not going to ask you for any information. So that's the dead giveaway of a scam.
Now I'm going to go back to Barry, and we want to talk about vaccinations and some stuff that's going on due specifically to COVID.
Right. Well, first, there is no approved COVID vaccine yet. We don't know when it'll happen. Medicare is forbidden to cover it until the FDA approves it, and usually it's fairly quickly after that. So hopefully when a vaccine is approved, you can talk to your doctor, your healthcare provider, to get that. I don't recommend or provide or prescribe any treatments, but we want to make sure that people get the preventive health services they can, which means the flu shot, because especially this year, if the COVID vaccine is not out and people get COVID and the flu, that could be deadly. So we want to try to minimize the effects of the flu. So talk to your doctor, your pharmacist, your healthcare provider about the flu vaccine.
Can I just say one thing, Barry?
Sure.
Am I right then in saying that if there's a person who's on Medicare and the government or whoever is saying there's an approved vaccine, but if Medicare is not willing to pay for it, that means it's not approved?
Usually, once the FDA approves it, Medicare will approve it quickly.
Okay.
All right. That's the norm.
FDA first. Okay.
Right. Yes, it has to have FDA approval. That's in the statute before Medicare can cover it.
Fine.
Now, the flu vaccine is covered 100%. There's no deductible, no co-insurance. If you go to any provider, a pharmacy, or a doctor who takes Medicare, it'll be covered 100%. We're hoping, and they haven't had written guidelines yet for the COVID vaccine. I can't imagine there would be a copay on that once it happens, because they're going to want as many people as possible to get it. So as soon as that's approved and it's on the market, because it'll take a little time for it to be manufactured and distributed. But again, everybody should talk to their doctor, their healthcare provider, to find out, can they get it? Should they get it? Right. So that's the first thing I wanted to discuss. Also, Medicare has made some changes. We don't know how long they'll last, but about the coverage for services related to COVID. The COVID testing was covered. If you were in a Medicare Advantage plan, it was covered without a copay. Also, Medicare changed a rule about skilled nursing facility, because people were in skilled nursing facilities and they only had up to 100 days of coverage. After a hospitalization, if you go into rehab or you need skilled care every day, Medicare would cover up to 100 days. After the 20 days, there's a copay, but they would cover most of it. Medicare eliminated that 100-day limit because people had no place to go and they needed to stay in that facility. Or if there was an active case in that facility, you didn't want those folks leaving, going back into the community if they were exposed. So Medicare waived that 100-day limit on skilled nursing facility cases with no copayment for those days. So
Barry,
if you had,
is there still an issue with how somebody gets admitted into a rehab place? Like if you get admitted from the emergency room and you were in the hospital for observation, or you were there as an inpatient or whatever, that whole area, I've known people who got admitted and then they had a huge problem getting coverage.
They
Because,
weren't technically they weren't admitted. They were in the hospital even overnight for observation. That is not an admission which is covered by Medicare Part A. Outpatient, which observation is covered by Part B, with the Medicare paying 80% of the fee approved amount, your supplement covering the other 20. But if you were not admitted, you wouldn't meet that 3-day admission requirement to go into a skilled nursing facility. The law is very specific. You need to be admitted for 3 days, not counting the day of discharge, before going into the skilled facility for rehab or skilled care after hospitalization. So if you're in the hospital, you got to make sure that you're being admitted. You got to talk to your doctor. Now, a regulation was passed about 2 years ago called the Medicare Observation Outpatient Notice, or MOON, because with the government, everything is an acronym. Between 24 and 36 hours, you had to be notified if you're admitted or not, of your admission status. And if you're not admitted, talk to your doctor saying you should admit me so I could then meet my 3-day requirement. Because outpatient, even if you're staying overnight, does not meet that 3-day requirement. And a lot of people were getting stuck with large bills.
I know
because
some.
they went into a facility thinking they were in the hospital for 3 days. They were in the hospital, but they weren't admitted.
So, and that's probably one of the things you really don't think about if you have somebody in that kind of situation. It doesn't enter your head.
The
It won't
worst,
now, I can tell you
the,
that.
wor- the worst time to start thinking about your coverage is when you're ill and when you're getting treatment for a condition, especially that requires hospitalization, because you know they're going to throw you a lot of papers at you. And when you leave, they're going to give you a whole folder, a binder filled with things to know and things to remember. That's the worst time to try to learn this stuff.
Yeah.
You know, Barry, you just made a very important statement there. That's the worst time to know about Medicare, Medicaid, your estate planning, your will, everything in life.
Right.
Everybody
Yes.
waits until all of a sudden you're on the sick bed, you're on your deathbed, God forbid, you've been in a terrible accident, you have corona, something. And then they start asking questions. And unfortunately, some things you can rectify quick enough. And other things you can't. It's too late. You didn't know it, and then everybody looks back and says, "We could have, we should have," and.
Look, Monday I got a call from somebody who was in the hospital outpatient, had a large bill. They never took Part B because they were never sick.
Right.
So they wanted to sign up for an Advantage plan, which they couldn't because they didn't have A and B, and they wanted it to be retroactive to cover that bill. And I said, "Look, do you have fire insurance? Or are you going to wait for the day after you're fired to buy insurance to get that covered?"
That's true. That's a good analogy.
That's a good one. I agree with you 100%.
Yeah.
It existed for people. They don't want to pay attention to it. And it doesn't take that much. And I mean this very sincerely. And this goes back to Christina and Otto, because the three of us seem to be doing this. The information is brought to people's attention every week. You just have to act on it. I mean, we can't make anybody do anything. People are listening to this program today. They have your phone number. They don't want to make the phone call. They don't make the phone call. And then they get in the hospital for 2 days and they're sent home and something happens. And it's like, well, why didn't I stay for one more day and have it covered? It's too late.
Exactly.
Again, you're not doing anything retroactive. You can't.
That's right, especially with insurance.
No, 100% so.
Yeah, so we want to make sure that people do understand those rules, make sure they get the preventive services that Medicare covers, and there are quite a few. When the Medicare new book comes out the end of the month, it'll have all the new plans for next year. It may not give you a description in detail of the benefits, but it'll give you their names, their contact information, maybe a summary of the benefit. But we're going to distill that for Nassau County at the end of the month once we get that information, so people can call us. We'll know what the new plans are. We'll be able to help people find a plan that works for them. So we want to make sure that everybody is getting ready. Like you say, you can prepare. You know what things you need to ask.
Right.
Is my doctor in this network? right? You can talk to the doctor. Does this coverage cover these additional services? If I need dental work, how can I get that through the plan? Or, does Medicare cover what types of equipment at home? So all these things, we can help people figure that out.
Barry, just a question. Does that mean, like what we talked about earlier, Plan N and Plan G, that they're not really firm at this point in time?
The benefits are.
The
The
benefits
benefits are fixed in law.
right.
So no matter who sells Plan G, benefits are identical no matter who sells it. The
Yes.
only difference is cost.
Yeah,
Same with Plan N. Now, those rates usually go up early in the year, like January. That's based on the state regulation. Even though they're federally regulated in terms of the benefits, their premiums are determined by the state, Department of Insurance. So they will, and the plan, like one of the plans is already requesting an increase. We don't know if it'll be approved or how much. So we have to wait for the state to make that decision. But we could tell the people this is what they're charging now. We know what the benefits will be in perpetuity. And if you sign up for that plan, you can keep it forever.
Is there a limit on how much they can increase the premium?
That's up to the state.
Right,
So,
okay.
The only limit would be what makes them not competitive. I mean,
Right.
there are a couple of plans now that are much less expensive than the others, and those tend to be the most popular plans, and they should be because the benefits are the same. If you could buy a plan for $192 a month, why would you pay $350 for the identical plan from another company?
And I'm just going to repeat something, Barry. That would be something you're bringing to somebody's attention.
That's right.
Right. Which is tremendous. I mean, somebody thinks that $350 is the best plan in the world, and you're going to turn around and say for $190, you're getting the same exact thing.
And we'll even mail it to them. We
Yeah.
have a chart of all the plans, what they cover, and what each company charges. It's all on one sheet of paper. That's
amazing.
easy. The Medicare Advantage is more complicated because they're not standardized, but Medigap is easy. One other thing I want to mention before you cut me off.
Okay.
A lot of people have a retirement benefit if they work for a level of government, county, state, federal, or they work for a large company that offered a retirement health benefit. That's separate than Medigap. Those are not standardized. Those are retirement benefits. And I never recommend people drop that, because if you drop a retirement plan, you may not be able to get it back if what you switch to doesn't work. So let's say you're a retired teacher, a retired state employee, a retired Fed like me. I would never drop my plan because I couldn't get it back.
Good point.
I had a situation where I worked for a large company, and they decided to get out of the insurance business. And the good thing about them was they at least gave money to everybody to every year to offset the cost of going out on the marketplace. But I also know somebody else whose company decided to get out of the retirement insurance business altogether, and then they had nothing. They had no money offsetting it, and whatever they had to pay was completely out of pocket.
I've seen both instances. And again, if you're lucky enough to get a stipend to help cover your insurance costs, whether it's a Medicare supplement or a plan on the marketplace because you're not on Medicare, if you're lucky enough to get that stipend, that's great. And I certainly recommend people take advantage of that if they can. And I've seen where companies said, no, I think Bethlehem Steel in the early 90s, all their retirement benefits for health insurance went away.
Yeah, that's a tough one. I work for Mars,
Mhm.
since we're mentioning names, and they're very good about not just dumping. You know, they support the employees. They're a very good company to work for.
Was this Mars Candy?
Yeah.
Oh, we'll talk later.
Well, I was with a part of it called Mars Electronics.
Ah,
It's
okay.
the only non-food part
He's
of.
not the M&M guy.
Yeah.
No, all right, well
You
then.
know what? Just to offset that, when we had meetings, I used to bring a big box of M&Ms into meetings, and I was in sales, and we'd put this big box of M&Ms in the middle of a conference room table at 9 o'clock in the morning, and people were gobbling up those M&Ms like.
Yeah. They're addictive. I know. Yeah. But anyway, that's kind of what I wanted to discuss today. I want to make sure that people get the health care they should. Again, we always recommend talk to your doctor, your pharmacist, your healthcare provider to get expert advice on what is best for you medically. We can help you with your insurance, your health care and your health insurance, but the actual provision of the care, people say, well, should I take this drug or that drug? And I say, talk to your doctor, talk to your pharmacist. I'm not a lawyer. I can't tell you about Medicaid plans and how various ways of lowering your income. You got to talk to the professionals who are experts in those fields.
Perfect.
We can guide you.
Barry, I want to thank you very much for the time today. It has just been a wealth of information for people. They're going to see this on the radio, hear it on the radio, and they're going to see it on TV next week. You've been listening to Senior Talk Radio here on 88.1 FM and WCWP.org.